Are bioethics different in a pandemic than in just sort of every other time?
So one way to think about what I and my colleagues do around the world, this is not a local phenomenon. I am happy to mention that the University of Miami Ethics Institute is a WHO collaborating center in ethics, and we've been working with our colleagues around the world most recently rather, on artificial intelligence and guidelines for its appropriate use, and also have been doing stuff in public health. So think of ethics or health ethics is the top branching node here, right at the top of my nose, I guess, right? Underneath that, think of three different sub-branches. One of them is going to be clinical ethics, the practical issues that nurses and physicians face in taking care of patients, either ambulatory in a clinic or in a hospital. Second one is going to be research ethics, how we use science to try and learn how diseases work, how to prevent them, what drugs work, and that sort of thing.
But that's all bioethics, correct?
Yes, it is, which is why bioethics is much broader. Medical ethics is just that bit about medical practice. Bioethics is all professions and these other three legs of the stool. So clinical ethics, research ethics, and the third leg is public health ethics. Public health sciences include epidemiology, biostatistics, prevention science, and so forth. Right? And so to answer your question, Dr. Schulman, the answer is no. We want these to be how should we put this? Anastomosed. I remember what that means. And anastomosis in GI is when you link together two tubes in your gut, or it might be elsewhere than that. You do it with two veins or arteries. It's when you connect two things, and we want to link these things together with each other. In part because if you're a physician, you're seeing a patient, you're learning something that could be useful to other patients. If you're doing that informally or collecting data through a health department, that's contributing to public health. Perhaps you're doing your research and you enroll your patient in a study to actually do it more formally. If you're in public health, you want to keep up on what all the others are doing. And if you're in research, it'd be irresponsible not to know what the standards are in clinical care and also what's happening in public health. So they are, think of them as like three electrons orbiting a nucleus of shared values.